Assalamu alaikum. My name is Shazaib Gill and I am a student of BS Clinical Psychology. So, our topic for today's video, the topic that we are going to cover in this video, is the Fragile X syndrome. Well, the Fragile X syndrome is a genetic condition which causes a range of developmental problems, including learning disabilities and cognitive impairment. In today's video, we're going to learn about the causes of the Fragile X syndrome. We're going to have a look on the symptoms of the syndrome, and we're also going to learn about the possible treatment of the Fragile X syndrome. So, moving on to our topic, Fragile X syndrome is an inherited genetic disease that causes intellectual and developmental disabilities. Well, sometimes it's also known as Martin-Bull syndrome. So, the people with the Fragile X syndrome experience a range of developmental and learning problems. We're gonna have a look on the problems further in the video. Well, the Fragile X syndrome can cause learning disabilities, developmental delays, and social problems. But there's a fact that the intelligence level may vary according to the gender. The girls with the Fragile X syndrome might have a normal intelligence level, but the boys won't. The boys won't have a normal intelligence level. But to learn about that fact, first we have to see what actually causes the Fragile X syndrome. After that, I'll explain how it varies in boys and girls. So, the major cause, or we can say the only cause behind the Fragile X syndrome, is that the Fragile X syndrome is caused by a mutation. Mutation actually means a change in the DNA. So, a change in the DNA FMR1 gene, which prevents the body from making an important protein called the FMRP. So, is it clear that FMRP is a very important protein which is not produced in the body because of the change in the FMR1? Well, this is the protein which helps creating and maintaining connections between brain cells and the nervous system. So, when this protein, the FMRP, is missing, signals from the brain may be misdirected, which causes the developmental and learning problems found in the Fragile X syndrome. As we can see that the most important protein, we can say, which creates and maintains connections between the brain cells and the nervous system, is missing. So how can we even assume a person to work properly or a brain to work properly? So this is the major reason, the missing protein in the brain, that causes the Fragile X syndrome, which then further leads to intellectual disabilities and learning problems and behavioral problems and downfall in the intelligence level of a person. Well, here you can see the left one, the X chromosome on the left side of the picture is the X chromosome of a normal person, whereas the X chromosome on the right side of the picture is the chromosome of a person with the Fragile X syndrome. We can clearly see the difference over here in the X chromosomes. So I hope that the cause of the Fragile X syndrome is clear now. You guys have clearly understood the cause behind the Fragile X syndrome. Moving further, well, as the cause is clear, so let's now talk about the symptoms of the Fragile X syndrome. Talking about the symptoms, well, the developmental delays are one of the major symptoms of the Fragile X syndrome. Well, the developmental delay refers to a kid who hasn't gained the developmental skills that the other children of his or her age have already developed. Delays can occur in the areas of motor function or language or social skills. It can be anything, but it can clearly be seen. I mean, the other children of the same age can easily perform the following tasks, which the children with the development delays cannot. So, the developmental delays are one of the major symptoms that are found in the children affected with Fragile X syndrome. Well, another very important symptom which is found in the children affected with Fragile X syndrome is this stuttering issue. Stuttering is actually a speech disorder which is referred to the repetition of sounds or words or continuously taking pauses in between the sentences. Well, the individual who stutters actually knows what he or she would like to say, but still they have trouble in pronouncing or producing the flow of the sentence or the word. Moving forward, the next symptom is the intellectual and learning disabilities. I mean, having trouble learning new skills. Well, the children who are affected with the Fragile X syndrome might have problems in learning very general skills, which the other children can learn very easily, but still they might be having problems in learning those skills. For example, such children might take longer to learn to speak, or maybe to learn to walk, or to learn how to take care of their personal needs, such as dressing, eating. I mean, they might have problems in learning the very basic tasks. Well, the next symptom is a social anxiety issue. I mean, children might have a fear of talking to people, or they don't like meeting new people, or going into family gatherings, or making new friends. They have social issues, they don't like to socialize that much. Well, these are some more symptoms which are found in the children affected with Fragile X syndrome. So, the very first symptom written over here is autism. Well, it's quite similar to what we have discussed earlier. I mean, the child might have problems with social interaction and communication and might repeat behavior. It's just like that. And the next symptom is impulsiveness. Well, impulsiveness is like doing something without thinking about the consequences or without a proper thought. I mean, you just do something without thinking of it. You just felt like doing it and you do it. It's just like that. Well, here you don't think about what happens next. You just do it without thinking about the consequences. The next symptom is about having attention difficulties. Well, it's quite easy to understand. I mean, the child cannot stay attentive even if he wants to. He might slip away in his thoughts, or he cannot stay focused on a single task even if he wants to or he's told to. He cannot stay attentive for a long period of time. As we are moving forward, you can see that we are continuously talking about similar things. Well, all of these symptoms are somehow related to one another or somehow similar in some way. Yeah, the next symptom is having social issues, as we discussed earlier. They won't make eye contact, or they dislike being touched. So, these were some of the symptoms that are found in the children who are affected with the Fragile X syndrome. So, let's move forward. Now, we're going to talk about some of the physical abnormalities which are found in the people with the Fragile X syndrome. Well, they look different as compared to other normal people. They have a narrow face, large ears, flat feet, and a prominent forehead. Well, I've attached some examples in the next slides. Let's move on to that so you can clearly understand about how they look. Now, this is a child who has this Fragile X syndrome. You can clearly see the narrow face he has, large ears, prominent forehead. I mean, you can clearly see that he is different as compared to other normal children. Now, we are going to talk about a very important fact regarding the Fragile X syndrome, which I told you guys about earlier in this video. That how the intelligence level of the girl might stay normal, whereas the intelligence level of the boy will not stay normal if they are affected with the Fragile X syndrome. Well, this does sound a bit weird, but it has a very clear explanation. I mean, as it is written over here, that the FMR1 gene is found on the chromosome X, which means that females who have two X chromosomes have two copies of the FMR1 gene, and males who have one X chromosome have only one. If this X chromosome is not working, there is no backup. This is why boys often have more severe symptoms as compared to girls. Well, as we all know that girls have two X chromosomes and boys have only one X chromosome. So in terms of girls, if one X chromosome isn't working as they are affected with the Fragile X syndrome, the other one will work and create the protein which is required for the brain cells and nervous system to work. So even if a girl is affected with the Fragile X syndrome, it won't affect her intellectual abilities or physical abilities. And the studies shows that out of 4,000 boys, there's one who is affected with the Fragile X syndrome, whereas out of 8,000 girls, there's only one girl who is affected with the Fragile X syndrome, and still it doesn't affect her intelligence level. But yes, studies have shown that the girls who have the Fragile X syndrome might face pregnancy issues. So this is how the Fragile X syndrome works differently in both of the genders. Well, if we talk about the treatment of the Fragile X syndrome, unfortunately, Fragile X syndrome is such a genetic condition which is lifelong and it can never be completely cured. But yes, with proper medication, we can minimize the symptoms of this condition, and individuals with Fragile X syndrome who receive appropriate education, therapy services, and medications have the best chance of using all of their individual capabilities and skills. But as we all know that not all of the people are fortunate enough to receive the appropriate medication and education and therapies from which they can learn using all of their individual capabilities and skills. So the medications which are typically prescribed for behavior disorders or anxiety issues are prescribed to the people who are affected with the Fragile X syndrome, so we can minimize the symptoms of this genetic condition. So some of the medications that are usually prescribed to such people are written over here. Some of the services that should be provided to the children with Fragile X syndrome are the special education, speech therapy, and behavioral therapy, so that they can make the most out of their potential, so they can learn to use most of their capabilities. Well, as we know that they do have special needs. I mean, they're special, they aren't like others. They're different, their needs are different, their needs are special, so they should be treated specially as well. They should be provided the special education and special therapy so they can learn to use their individual capabilities, their skills, and be beneficial for the society. So this was all for today. We learned about the Fragile X syndrome, its symptoms, its causes, and the possible treatment and services that should be provided to such people. I hope that it was easy for you and I explained it clearly and you guys learned from it. But still, if you guys have any questions regarding the Fragile X syndrome, please feel free to ask those questions in the comment section below. I'll be glad to answer them for you. Thank you so much.